No worries. Oh, that might not work. Can we do this?
I think it got weighted down by all the mics.
How's that? Great. Good, everyone? Well, wonderful. Good afternoon, everyone. What a crowd we've assembled here today. But thank you for joining us on the exciting occasion of announcing the Colorado Affordable Health Care Option. I am joined by a committed group of healthcare advocates, legislators, and Coloradans who need affordable health care. My name is Carrie Donovan, and I'm the state senator for Senate District 5, which represents 7 counties that hug the continental divide of the Western Slope and the high country of Colorado, and who've been the epicenter of the healthcare cost debate in Colorado for years. This conversation has been happening in the state since I first announced for office in 2013, and I think even before that. It's the same conversations we're having today in 2020. And just like them, the people I represent, I'm frustrated, beyond frustrated with the lack of action to inject more choice into the marketplace and to lower costs for our friends, neighbors, and family. I've sat on a door stoop in Basalt and listened to a couple who told me how they were debating who would get health insurance that year because they couldn't afford to both purchase health insurance and enroll. I helped a woman in Delta County who is in hospice navigate a paperwork mess just so that she could get a ride home and pass away in peace, surrounded by the place that she knew. These are examples of a broken healthcare system, a system that has lost focus on the people that it's supposed to protect and the people that it's supposed to serve. But it's not for lack of trying. We've tried working hand in hand with the full spectrum of the healthcare industry for the past years and sessions. We've proposed solutions they've supported, and we've provided real state dollars towards lowering the cost of care for Colorado citizens. This is important work we've done in past sessions, and we're proud of that work, and we're going to build on that today. Through reinsurance and fixing the hospital provider fee, we've taken action to keep hospitals open and cut red tape with the promise of lowering costs and ensuring high-quality care. Today, we're asking our partners in this fight, partners we've supported in past sessions, to give in the same way that taxpayers have, and to share the responsibilities of lowering costs and increasing consumer choice across the state. We are here today still in dire need of a healthcare option that puts Colorado families first and provides an affordable choice across the state. And Colorado's story isn't unique. Across the nation, Americans are getting ripped off by rising insurance costs, the price gouging of prescription drugs, and the lack of choice in the market. Colorado has worked vigorously and authentically to ensure that hospitals are not on the hook for uncompensated care. The ACA, including the Colorado Medicaid expansion, helped thousands of Coloradans who were previously uninsured gain coverage. This drastically cut down on the amount of uncompensated care hospitals were expected to provide. The national trend would have suggested that those savings would have resulted in lower costs for consumers, but unfortunately we didn't see that in Colorado. Instead, we have seen record profits for large hospital systems at the same time that the cost of care has gone up for working Coloradans. Not all hospitals are making huge profits, and we don't want to say that message today, like those in rural Colorado. But some are, and we can't be afraid to bring attention to the big profits that are impacting the overall system of healthcare and the costs that end up hitting our pocketbooks. The Colorado option will help us put people over profits. The only thing that we can expect to change from a world before we enact the Colorado option to a world after we would enact the Colorado option is that consumers will have more choice and that the individual market will gain a cheaper insurance product, maybe even up to 20% cheaper in some parts of the state. Every other industry has sacrificed on our path to lowering the cost of healthcare, and we are bringing hospital systems to the table with this bill. The hospital systems have a win-win choice, I think, with this bill. Option 1, continue to profit while helping to eliminate barriers to healthcare for thousands of Colorado. Or continue to profit and maintain the status quo of expensive healthcare and a near insurmountable barrier to affordable healthcare for many families across Colorado. Those of us in the building know that what is good for people is often good for business, and I think this bill will illustrate that. After months of stakeholder engagement across the state in Spanish and in English, and an extensive open comment period, the Department of Insurance released a report as required by last year's bill, which has served as the foundation for this bill. There's been a lot of thought and work put into where we find ourselves today at the halfway mark of the session. We have built a uniquely Colorado solution that provides real support to struggling people, increases competition, and ensures our Colorado hospitals will have the resources they need to continue to serve our communities. The Colorado option will lower premiums for Coloradans by up to 20%. It's estimated that premiums in Grand Junction could be reduced by $120 a month. That's real money back into families' budgets. And this is the change that Coloradans are seeking. This is the change we need. This is the change we've promised. I promised to put my constituents first when I ran for office in 2014, and I promised to put my constituents first when I ran for re-election. This is the issue I hear at the doors, that we must lower the cost of healthcare and we must make healthcare and consumer choice a priority of the General Assembly. No matter where you live, every Coloradan deserves an affordable healthcare option, and the Colorado option is a step in that direction. Thank you very much. We all know that there are real stories behind the legislation that we write in this building, and we would like to now give the podium over to sharing some of those real stories. I'd like to introduce Peg Ellefson, who will share her story with you. Thank you.
Thank you, Senator Donovan. My name is Peg Ellefson. I'm from Castle Rock, Colorado. I'm here today on behalf of all the self-employed business owners and entrepreneurs to outline the costs of what we face for healthcare. The following is my experience on the individual market. My husband and I are both self-employed, and so our premiums are $16,224 for the year. That's just for the two of us. Our out-of-pocket max is $13,700 for a total of $29,924. I've been asked by some people if that included us, both my husband and I, and all our employees. I said, no, we don't have employees, that's just for the two of us. I compare this to going to a car dealership and purchasing a car, and the dealership says, well, we'll give you free preventative maintenance, and we'll give you discounts on other repairs, but you can't drive the car until you completely pay for it. Oh, and by the way, January 1st, you have to buy the car again before you can use it. I've also been told by some providers that we take that type of insurance, but not that plan, which is very confusing. Would I like to do something else with this money, this $29,000? Now granted, if we don't get sick, you know, it's $16,000. But if we do get sick or we have to have some procedures done, it's above the $16,000. Would I like to do something else with that? Would I actually like to buy a car? Maybe. Would I like to go on a vacation? Absolutely. But we have to save that money just in case one of us gets sick. Also, self-employed people pay higher premiums for health insurance. We pay higher deductibles. We have to pay both sides of FICA. So it seems like we're getting it one way and another. So it would be nice to have it one way or another. It is my hope that we can get both sides of the aisle together to support the Colorado Affordable Health Care Act. Thank you for your time. Our next speaker is Laura Packard.
Hello, everybody. My name is Laura Packard, and I'm a small business owner here in Denver. About 3 years ago, I walked into a doctor's office with a nagging cough and walked out with a stage 4 cancer diagnosis. But I'm still here today because of the 6 months of chemotherapy and the month of radiation that I went through. I'm still here today, and this should be a happy story. I'm in remission. And it is happy, except these are all of my bills after cancer. Visiting my oncologist for the first time last year here in Aurora, I received, so this is just for a new patient visit and some lab work. I received a bill for $7,554.21. Now that's how much they billed. After insurance, I only had to pay $1,817.45. As a part of this bill, I was checked for respiratory viruses, i.e. the flu, and UC Anschutz billed $1,227.11 to check me for the flu. So that's important information to keep in mind right now. We need more competition, and we need to make sure the hospitals that are making obscene profits off of patients like me pay their fair share. That's why I support this bill, and I hope that my legislators do too.
Good afternoon. My name is Chris Kennedy, and I represent House District 23 in Lakewood and Central Jeffco. And you know, it's completely appropriate that this bill has been led by two legislators representing rural Colorado, because that is where we've seen some of the highest costs in the country. But this is not just a rural problem in Colorado. The voters in my suburban district have been talking to me about this as one of their top priority issues since I first started knocking on their doors for my first campaign in the beginning of 2015. That's why I asked to serve on the Health Committee in the first place. And since my first day as a legislator here, I've been working on trying to unravel the problems in our healthcare system. How can we prioritize quality and accessibility of healthcare while also not letting it become a complete runaway train with the high cost people are paying right now? And this is a tough problem. What I have learned over this time is that this is about a broken system, and it's not about particular actors in the healthcare space doing anything malicious or wrong. When we're talking about hospitals or doctors or drug companies or even insurance companies, we're talking about people in the healthcare space who are trying to do their part of the system. Hospitals trying to improve the quality of care. But what I've seen is that this is a market failure. We do not see an incentive for hospitals to lower their costs and make it affordable to their consumers. And that is a real problem in our state. That is why I firmly believe that now is not the time for tinkering around the edges and working on small policies to make small differences. We need big changes in our healthcare system to address the market failures we are seeing in healthcare in Colorado. And that's why the public option is such an important step to give people, first on the individual market, but then soon on the small group market as well, a choice for where they can get a different kind of health insurance with guaranteed low prices and guaranteed accessibility to strong networks of providers across Colorado. So I was very excited when Representative Roberts and Senator Donovan asked me to step in and help them by signing on as a co-prime sponsor on this bill. I'm really excited about continuing to communicate with the people of my district about how important a step this is for Colorado. And I think that this is going to be a very, very meaningful way to address the high cost of healthcare for our constituents. Next, I would like to invite forward Sean Satterfield.
Hello, my name is Sean Satterfield, and I'm a small business owner from Evergreen. My small business, Mazzaro, is a web development agency, and we've always been limited in plan options available of what I could offer my employees. However, at the start of this year, I became the sole owner of my company, bringing us down below the minimum requirements, and I can no longer purchase a small employee plan and being forced to look for a new individual plan on the individual plan market. Additionally, I lose out on hiring candidates that I want due to my inability to offer health benefits. I'm facing premiums of $1,045 a month with a $6,000 deductible, meaning that I will spend more than $18,500 a year on healthcare expenses. That's not affordable insurance. And to top it off, I can't find a plan that will allow me to continue to see my general practice doctor of 28 years. To make matters worse, I recently had to take my husband to the urgent care center where he was treated with a single nebulizer, and we were in and out in less than 30 minutes. We just got the bill. It's over $6,000. Even though a single nebulizer dose through my pharmacy costs 13 cents. We were already grappling with the high cost of coverage, and now we don't know how we're going to afford this outrageous bill. The urgent care center points to the insurance company, and the insurance company points to the urgent care center when it comes to answering why these outrageous charges. I wish our story were an outlier, but it's not. Too many families and small businesses are struggling to afford health care coverage and the care they need to be healthy and productive. Simply put, the costs we are paying for our health insurance and our care are out of control. That's why I wanted to come here today to speak out in support of the Colorado Health Insurance Option Plan, because it is an important step in the right direction. It will help families like mine while holding hospitals and insurers more accountable. When I hear that Denver area hospitals alone raked in more than $2 billion in profits and then receive an unjustifiable bill of more than $6,000, I'm infuriated. We are being taken advantage of, and it needs to stop. Our ability to operate and grow as a small business is being directly stifled by our healthcare costs. Insurers need to spend more premiums on actual care, and hospitals need to lower their costs they are charging consumers directly in out-of-pocket costs and through our insurance. The Colorado option is an opportunity to do both of these things and make it a little more easier for people like me to afford the coverage and care we need. I hope our legislators understand the importance of this bill and pass it in this session. Thank you.
Good afternoon. Thank you, everybody, for being here. Thank you, Peg, Laura, and Sean, for sharing your stories. And thank you to my colleagues, Representative Kennedy and Senator Donovan, for your partnership on this bill, and my other colleagues who are here to show their support. I'm Representative Dylan Roberts. I am proud to represent Eagle County and Routt County in the State House. You've heard from Senator Donovan about the history of this bill and the ample evidence that shows how our healthcare system is not working for too many Coloradans. And you just heard from some of the Coloradans from across the state who struggle to afford their insurance on the individual market. Coloradans who have survived cancer and fear they won't be able to afford the care they need to continue in their remission. And add those to the countless stories I hear back home at town hall meetings, knocking on doors, about who are my constituents who are going without the security of health insurance simply because it's too expensive for them and their families. Today, we are here to introduce a bill that will provide a real solution to the life-altering sacrifices too many Coloradans make to pay for some of the highest health insurance costs in the nation. For over 2 years, and even more so since last fall, I've spent countless hours meeting with constituents, consumer advocates, insurance carriers, and hospitals. I've listened to their concerns, and their input is directly reflected in this bill. The Colorado Affordable Health Care option that we will unveil today is a public-private partnership to offer Coloradans who buy insurance on the individual market a cheaper health insurance option. It is truly a Colorado solution to a Colorado problem, and one that the state legislature should move forward with this year. Coloradans cannot afford to wait any longer. Now I'm going to walk through a little bit of the details of the bill, and then we can take some questions. So the Colorado option provides choice and competition for Colorado families. Every single Coloradan will have competition in the market regardless of where they live when this bill passes. The citizens in the 22 counties out of 64 counties in Colorado who currently have a monopoly over their healthcare choices will finally have a real competitive choice. The days of being forced to pay outrageous premiums because it's the only option will be over. This bill not only ensures competition, but has built-in protections to consider a carrier's network and other insurance options in the area, like purchasing collaboratives and co-ops. The Colorado option will hold corporate healthcare profits accountable. Every hospital under this bill will not only be able to cover their costs, but to receive fair profits. But unlike the status quo from outrageous price gouging, consumers will directly benefit from more reasonable rates. Because of the meetings I've held with hospitals, we provided a rate structure that ensures our hospital system is well-resourced and ready to serve the people of Colorado. Rural hospitals, independent hospitals, and critical access hospitals will all receive additional support because I know that they face unique hurdles to serve patients. If you are one of those hospitals, we heard you and we prioritized you in this bill. Hospitals who serve a high Medicaid or a high Medicare population will also qualify for higher rates to support the care they provide for our most vulnerable populations. And finally, we intentionally reward hospitals who are good stewards of their resources already. If hospitals manage their underlying healthcare costs responsibly and effectively, they can apply for a higher reimbursement. There are opportunities for every single hospital to profit under this plan and preserve the resources they need to save lives, cover uninsured patients, and increase programming. We can, at the same time, value the incredible work of that our hospitals do for our communities while lowering the costs for consumers. We have to. And the Colorado option does that and proves that these two goals are not mutually exclusive. Under the bill, they work together so everyone benefits. Now, there are going to be meaningful checks on this Colorado option. The Colorado option has built-in oversight because the bill creates an independent advisory board that will provide input on plan design, including any pre-deductible services and value-based services. The board will serve as a vital body that advises the Division of Insurance about the best way to serve Coloradans. Stakeholders from all parties interested in the Colorado option will continue to have a significant voice in this process through the board. The checks and balances are so powerful, in fact, that the board can override decisions of the Department of Insurance if they feel that the plan needs changes. This board will exist alongside the Colorado option, which means that stakeholders who have always had a voice in this will continue to be a foundational element of the Colorado option. And most importantly, this bill will decrease healthcare costs for hardworking Coloradans. The individual market is unique in its design. The risk pool and premiums are set on a statewide average. So lowering the rates across the state will guarantee lower healthcare costs on the individual market regardless of where you live. Every legislator in this body has vowed to support bills that give Coloradans a hand up and a chance for a happier, healthier, and financially more stable life. The Colorado option checks all of those boxes. So, the Colorado option is a promise to Colorado that we are listening and willing to act. We cannot be here 10 years from now decrying the cost of healthcare. We cannot tell the people of Colorado that the status quo is okay. The Colorado option is the first guarantee that they will have an affordable choice on the individual market. We were sent to this building by our constituents to solve this problem. Like Senator Donovan, this is the #1 thing that I hear back home. They sent us here to fix this. The Colorado option does that in a careful, responsible, and bold way. So with that, we'll open it up for some questions.
Representative Roberts.
Yes.
Under this bill, you tell hospitals how much they can charge for procedures for Coloradans on this option. The majority of Coloradans, though, get their insurance through their employers. Won't hospitals just shift costs potentially to Coloradans who have insurance through their work?
So we don't believe that's the case, and I think the data shows that that's not the case. We're talking about the individual market, which is about 300,000 Coloradans per year on average, about 8% of the state. So we're trying to target a really acute problem this is not a plan that's going to impact every Coloradan, because this is a choice that will be available to Coloradans if they want to purchase it. And we're hoping to bring more uninsured Coloradans currently onto the plan, and the estimates show that up to 18,000 people will be able to get insurance because of the lower prices who don't have insurance currently. So we're targeting the individual market, and we think that when you compare the individual market to the much larger insured pool that exists in the state, that the impact will, that there will not be a negative impact. That means cost shifting can occur. But we have put in protections in the bill to protect against that, just in case there is an argument that happens. And the Division of Insurance will work with the board to determine if cost shifting is happening, and they have mechanisms under the bill to prevent that from happening.
If you could give us 1 second to adjust this.
Yeah.
Sorry.
I feel enlightened.
Yeah.
So can you talk about the evolution of the bill, and did you ever consider doing a public option like what you hear from Bernie Sanders or Elizabeth Warren that would create like a separate government agency that would be run by the government instead of this public-private? Can you talk about sort of the trade-offs in crafting your plan?
Sure. I can start if anybody wants to add. So this is a topic that Senator Donovan and I have been talking about for years. And Senator Donovan got to this building before I did. I'm sure she was talking about it before I got here. And this is a carefully laid out process that we passed a bipartisan bill last year to determine how best to implement this. And it was never the goal to have this be like anything that's being talked about nationally. We knew we needed a Colorado solution. And the way that we've crafted this in not creating a large, expensive new government agency is a financially responsible way to do it, because we're building it into the already existing private insurance market and giving some reasonable rules on that plan so that Coloradans can have a new option on the private market. But this is a financially responsible way for the state to go forward, because we're not putting the state on the hook for insurance liability, and it will not take a large general fund appropriation year after year to keep this plan going. The infrastructure already exists. We're just building into something to give people a cheaper choice.
And I'd like to add that particularly the liability aspect of it and be cognizant of the fiscal note to implement this program were two big driving forces as we worked with our colleagues across the aisle, talking to them about how this plan would roll out. So those were two pieces that we really wanted to make sure that it was a Colorado solution for Colorado.
Thoughts with the governor? I notice he's not here today. I see some of his staff, but I don't see him.
This bill now, after the work of 104, we worked closely with the support of the administration to kind of build the foundation and do some of the analysis and policy work, as well as that broad stakeholder process over the summer. But now it's in the hands of the General Assembly. And you see the three lawmakers in front of you, as well as our colleagues that will do the work on this over the next weeks to earn the support of getting it passed and sent to his desk.
Do you think he supports this, though?
You never speak for another policymaker.
And I would just note, we've been talking about this idea since before Governor Polis took office. This is not, this is something that's been driven by the legislature, and it will continue to be driven by the legislature now that we're presenting this bill to our colleagues.
You guys are up against a very powerful lobby in the healthcare industry. Is compromise a sign of weakness? Is the bill what it's going to be, or is the bill going to be something else when we get to the end?
As a member who served in the minority and was still able to get bills passed, I would never label compromise as a sign of weakness. We've already held and had an open door, have had many stakeholder meetings, some where we found areas of agreement and some where we walked out of the room and said, well, this might be a place where we're just going to continue to work on. We'll always be willing to hear ideas that will lower the cost of healthcare for the people we represent and increase consumer choice. But no, compromise is not a sign of weakness. Compromise is a good sign of government.
Is there room for more compromise, though, is what I'm asking?
Absolutely. It has to reach our goal, right? Our goal is to lower the cost of healthcare on the individual market and increase consumer choice. If you have ideas of how to achieve those two things authentically in the timeline that's presented in the bill, let's hear the idea.
Representative Roberts, real quick, you said about 300,000 Coloradans would be impacted by this bill, people who get their insurance from the individual market. Is that the number?
Well, it's going to be a choice for those 300,000 who are on the market. There's nothing about this bill that forces them to move to the Colorado option. It's called an option for a reason, because it's a choice. And nobody's forced onto this plan. It'll be there when they go shopping for their health insurance every fall like they normally do. It'll be an option that's on the menu of choices, and they get to decide on their own whether choosing the Colorado option is a good choice for themselves or their family, or keep what they have. And hopefully, it will also bring new people onto the insurance rolls who currently don't buy any insurance at all because it's too expensive.
The bill last year to study this option had a Republican sponsor, from the district. I think we're going to face the same issue. You still have the Republican support with this. Are you expecting co-sponsors, or has it changed in the way that that will?
So yes, I was proud to work with Representative Catlin on that bill last year. He's been involved in the process that has come after the proposal was announced. I still look forward to having those conversations with him. I think there's a chance that we get significant Republican support on a bill like this. I mean, a lot of those Republican representatives and senators come from rural areas of the state that are getting hit the hardest, just like Senator Donovan in my district. So like Senator Donovan said, we are willing to work with anybody, whether it's in the legislature or the industry who is involved in this bill, to make the compromises that are needed. And we look forward to having that conversation with our Republican colleagues. But this is a plan, like I said, we can't wait anymore. So we need to move forward, and we need to move forward now. And I expect we'll have support to get it passed. So there is language in the bill that will protect against any adverse impacts to the subsidized population. It may be the case that someone who does receive subsidies currently to help themselves buy individual market insurance will choose to stay on their regular individual market insurance because they'll be able to get a subsidy to make that more affordable. So that, like I said, nobody's forced onto the Colorado option. If the Colorado option isn't cheaper for that subsidized population, they still have the choice to stay on their current individual market plan and receive the subsidies to make it affordable for them.
Sorry, I'm having a hard time hearing you.
What's your plan to help those who see the premiums go up? Get the subsidies, you want to stay on the current plan and not go to the option that you're offering, but they're seeing the premiums go up. At this point, is that the federal waiver that you're getting money from the federal government to help them?
Well, like Representative Roberts, the bill contemplates that exact issue and how to address it. And it was a great benefit of having a lot of time to work on drafting this bill and the information that 1004 gave us, because with the actuarial analysis in our hands, we were able to have that kind of benefit of foresight and write the bill to address the concern that you exactly wrote. So the actuarial analysis, as well as the report from 1004, was the foundation on which we started, and then we wrote a bill that will address many of the issues that were raised as possible consequences of what a public option, Colorado option, would be.
What is the solution? Because that's one of every 5 people on the individual market to get their subsidies.
I think I would just add that the idea over the longer term is that this competition, having a new option in the market, does drive those costs down. Now, as we saw with the reinsurance program, there are times where their premiums went down, but somehow the calculation for the federal tax credit changed as well. And so I think we recognize that anytime we try to make an effort to lower premiums, that there are changes to what plans the health insurance companies offer. And that's not always easy for people, but we believe that there will be better options for people on the market with lower premiums or lower cost sharing if that's what they prefer, because people are going to be choosing these plans based on a variety of things. But we believe that after this plan is the law, people are going to have better options that are going to be more affordable with whatever network of providers they'd like to see.
Senator Donovan, one last question.
Sorry, this is going to be the last question. I know Senator Jody had a number.
Yes. Anyone else?
Anyone else?
I will yield the floor. No. Okay, so.
Oh, behind.
How will the advisory board be chosen, and will hospitals have a big say?
The advisory board is spelled out in the bill in detail, so we look forward to you guys being able to see that. And yes, we want all voices in around that table on the advisory board because, as Rep. Roberts mentioned, we're giving this board considerable decision-making process and really a voice in spelling out that how this plan will not only be rolled out, but will operate well into the future. So it is very important to have all aspects of the healthcare industry involved in that board. So I think we'll end there. Sincere appreciation for you all making time for us today to talk about a concept that we are very excited about. This will be the first of many conversations on the Colorado option going forward, and we all commit to having an open door and listening to feedback from across the healthcare industry as we strive to increase choice and lower costs for Coloradans. Thank you very much.